Today topic of discussion regulation of blood glucose level. The normal blood glucose level is 70 to 110 mg per deciliter. It is fasting, overnight fasting, 8 hours interval. Then post glucose load. It is 110 to 140 mg per deciliter. It's after 2 hours 75 gram of glucose. Then random, it's 70 to 140 mg per deciliter. It is the normal plasma glucose level by glucose oxidase peroxidase method. Fasting 70 to 110 mg per deciliter. Forced glucose load 110 to 140 mg per deciliter. Random 70 to 140 mg. It is the normal plasma glucose level by glucose oxidase peroxidase method. Now there are different sources of blood glucose and utilization. Different sources of blood glucose and utilization. Coming to the source of blood glucose. The important source of blood glucose level is dietary. Dietary carbohydrate after digestion and absorption contribute to the blood glucose level. So first one is dietary source. Main source is carbohydrate. After digestion and absorption contribute to the blood glucose level. In body, there is synthesis of blood glucose via gluconeogenesis. Gluconeogenesis means synthesis of glucose from non-carbohydrate. Non-carbohydrate precursors, that is include lactate, glycerol, prophenyl coenzyme A and glucogenic amino acid. Non-carbohydrate precursors, that is lactate, glycerol, prophenyl CoA and glucogenic amino acid. These four component is precursor contribute to blood glucose level via gluconeogenesis, mainly in the liver and kidney. Gluconeogenesis mainly in liver and kidney. Then another source of blood glucose is glucogenolysis. Glucogenolysis means breakdown of glycogen into glucose. Breakdown of glycogen into glucose. This contribute to blood glucose level and it is important source of glucose in between meals. Important source of glucose in between meals. In post absorptive phase, in between meals, the blood glucose level is mainly maintained by glucogenolysis. So these are the sources of blood glucose. Dietary carbohydrate source after digestion and observation of carbohydrate. Second one is gluconeogenesis, synthesis from non-carbohydrate precursors. The four important component like lactate, glycerol, prophenyl coenzyme A and glucogenic amino acid. Mainly synthesis via liver and kidney. Third sources glycogenolysis. All amino acid contribute to the glycogen except leucine, which is purely ketogenic amino acid. So third one is glucogenolysis, glycogen converted into glucose. Post observative phase, in between meals. So these are the three important sources which contribute to blood glucose level. Coming to the utilization of glucose, it is utilized by glycolysis, TCA cycle into carbon dioxide. utilized for energy generation. Then this glucose is utilized by HMP stunt, converted into carbon dioxide, utilized for NADPH production and reduction biosynthesis. Then it is utilized by the HMP stunt. Then well fed state glucose level is more. It is used for glycogen synthesis. Synthesis means glycogenesis. It is also utilized for lipid synthesis or lipogenesis. Also utilized for synthesis of different component like glycolipids, amino sugar, etc. So this is how glucose utilized in our body via glycolysis, HMP stunt, glycogen synthesis, lipid synthesis, and a different component like amino sugar, glycolipid, etc. When it crosses renal threshold, that is 180 mg per deciliter, it appears in the urine. When glucose appear in the urine, this condition is called glycosuria. There is different causes for glycosuria that include high carbohydrate, then renal causes, and a different condition. It crosses the renal threshold, that is 180 mg per deciliter glucose appear in urine. When cross renal threshold, that is 180 mg per deciliter. Now coming to how it regulated in our body. The important hormones which are responsible for regulation of blood glucose level, insulin and glucagon. When the blood glucose level is low, condition is known as hypoglycemia. When blood glucose level decreasing, that condition name is called as hypoglycemia. When the blood glucose level increasing, that condition name is called hyperglycemia. Blood glucose level decreases means hypoglycemia, increases means hyperglycemia. The only hormone which reduce blood glucose level is insulin. The one and only hormone which decreases the blood glucose is insulin. The hormones which is responsible for increasing blood glucose level, first one is glucagon, second one is epinephrine, then thyroxine, then growth hormones, then ACTH, adenocorticotropic hormones, then cortisols. These are the important hormones. These are the responsible for increasing blood glucose level. Now decreasing blood glucose level, insulin, this one decrease blood glucose level via different mechanism. First important is insulin increases the uptake of glucose. How it will decrease? Increase the uptake of glucose by the cell. These via insulin dependent transporters. Insulin dependent transporters, mainly the GLUT4. So via insulin dependent transporter, it increase the glucose uptake by the cell. Secondly, it is increasing uh, glycolysis and stimulate HMP stand. It decreases gluconeogenesis and inhibit or decrease glucogenolysis. So these are the different mechanism by which insulin decreases the blood glucose level. How insulin decreases the blood glucose level? increase uptake of glucose by the cell via insulin dependent transporter GLUT4. Then via insulin dependent transporter, it increases the glucose uptake by the cell. Then glycolysis increases, then increasing HMP strength, then decreasing gluconeogenesis and glucogenolysis. These hormones, glucagon mainly in the liver, epinephrine in the liver and muscles, then thyroxine, growth hormone, adrenocorticotropic hormones, and cortisol. They contribute to the increasing blood glucose level via mainly by increasing glucogenolysis. Glucogenolysis means breakdown of glycogen into the glucose, and they stimulate gluconeogenesis means formation of glucose from non-carbohydrate precursors. So these are the hormones which increasing blood glucose level. Now coming to the mechanism of regulation, there are different mechanism of regulation of blood glucose level. First we'll discuss the regulation of glycogen metabolism. It is important how insulin and glucagon regulate the blood glucose level via regulating glycogen metabolism. First, glycogen metabolism, the regulation key enzymes in the glycogen metabolism. Key enzyme for um, glycogenesis, it is glycogen synthetase, the key enzyme glycogen synthetase. And for glucogenolysis, the key enzyme is glycogen phosphorylase. Insulin and glucagon control these two hormones via phosphorylation and T-phosphorylation. This glycogen synthetase is active in dephosphorylated state. So glycogen synthetase is active in dephosphorylated state. Then glycogen phosphorylase is active in phosphorylated state. A name indicates it is active in phosphorylated state. Insulin favor decrease blood glucose level. Glucagon in favor for increasing blood glucose level. Now coming to pathway of regulation. Glucagon in liver or glucagon or epinephrine in the muscle, they attached to the receptor, they record cyclic adenosine monophosphate, they causes formation of adenylate cyclase. This adenylate cyclase convert ATP into cyclic adenosine monophosphate that increase the cyclic adenosine monophosphate level. This cyclic adenosine monophosphate activate the protein kinase. Protein kinase inactive is converted into active protein kinase. This protein kinase stimulate phosphorylase kinase. This is inactive. This inactive is converted into active phosphorylase kinase. This active phosphorylase kinase activate glycogen phosphorylase. Glycogen phosphorylase via phosphorylation. This glycogen phosphorylase is the key enzyme. It is a key enzyme of glycogenolysis. So it stimulate the breakdown of glycogen into glucose. So it stimulate the breakdown of glycogen into glucose stimulate or increasing blood glucose level. Calcium also activate glycogen phosphorylase and increasing blood glucose level. So this is how glycogenolysis, which stimulate via cyclic adenosine phosphate, glycogenolysis which stimulate via cyclic adenosine monophosphate, uh, glucagon and epinephrine. Now, this active protein kinase phosphorylate glycogen synthase, which is active in dephosphorylated state, become inactive due to phosphorylation. Inactive glycogen synthase. Due to inactive glycogen synthase, the glucose is not converted into glycogen. Active protein kinase phosphorylate glycogen synthetase, which is active in dephosphorylated state. This one active in dephosphorylated state, become inactive due to phosphorylation. Inactive glycogen synthase. Due to inactive glycogen synthase, this glucose is not here. Glucose is not converted into glycogen via glycogen and epinephrine. There is stimulation of glycogenolysis which increase blood glucose and it inhibit glycogen synthesis. Now coming to mechanism of action of insulin. Insulin, it causes utilization of this cyclic adenosine monophosphate into 5' adenosine monophosphate via phosphodiesterase. Due to the utilization of this cyclic AMP is protein kinase. It's inactive. Inactive protein kinase. Inactive protein kinase glycogen synthetase will remain in dephosphorylated state and it will stimulate glycogen synthesis from glucose. Also, there is inhibition of glycogenolysis. So, glucagon favor glucose formation. Insulin favor for glucose utilization. Insulin inhibit glucose formation. This is how glycogen metabolism is regulated. Now coming to regulation. Regulation of gluconeogenesis. Gluconeogenesis is the formation of glucose from non-carbohydrate precursors. There are 4 enzymes in gluconeogenesis: pyruvate carboxylase, phosphoenol pyruvate carboxykinase, fructose 1,6 bisphosphatase, glucose 6 phosphatase. So, insulin inhibit gluconeogenesis and glucagon stimulate gluconeogenesis. This is mainly by 2 mechanisms, that is induction and repressions. It is at the genetic level. Glucagon induces by pyruvate carboxylase. Insulin represses this pyruvate carboxylase, inhibit gluconeogenesis. There are different activators. For example, acetyl coenzyme A, it is an activator for pyruvate carboxylase, and citrate, it is an activator of fructose 1,6 bisphosphatase. This is how gluconeogenesis is regulated. In the regulation of glycolysis, in the regulation of glycolysis, three enzymes are important, that is hexokinase or glucokinase, phosphofructokinase, pyruvate kinase. So insulin stimulate pyruvate kinase and favor the utilization of glucose, while glucagon inhibit pyruvate kinase. That is how different pathway are regulated, that is glycogen metabolism, glyconeogenesis and glycolysis. Now coming to the status of glucose in various state, it having various state. First one is well fed state, within the glucose level is abundant, here glucose level is abundant. After meal, that is well fed state, when the glucose level is high, this glucose utilized for the glycogen synthesis, and the source of energy for the brain, that is glucose. Okay, this is glucose also used for lipid synthesis also. Glucose is high utilized for glycogen synthesis, sources for energy for brain, also used for lipid synthesis. In post observative state, that is in between meal, the glucose level is mainly maintained by liver glycogenolysis, and in the state source of energy for the brain it glucose. Then after 16 to 18 hours of starvation, the main source is gluconeogenesis. After 16 to 18 hours, it's by the liver gluconeogenesis. And there is a starvation of utilization of amino acid from the muscles, and the brain started utilizing ketone bodies. So ketone bodies are the sources to extent. After 3 days of starvation, the skeletal muscles, amino acid which are presented in the skeletal muscles, are protein. Uh, or protein which is presented in the skeletal muscles is utilized for the glucose production, and the brain only depended on the ketone bodies as a energy source, and glucose will be provided by the muscle breakdown. Next, estimation of plasma glucose. Mainly it is done by glucose oxidase peroxidase method. Estimation done by GOD POD method. It is replaced by hexokinase method. Nowadays replaced by hexokinase method in many institutions. So GOD POD method is important. Um, Increase in blood glucose level, it is known as hyperglycemia, and important cause of hyperglycemia is diabetes mellitus. Second one is hyperactivity of thyroid gland, pituitary gland, adrenal gland. So hyperthyroidism, hyperpituitarism, hyperadrenalism. And the causes of decreasing blood glucose level are hypoglycemia, that mainly include incorrect dose of insulin therapy, then decrease intake. Third one is hypoactivity. Hypoactivity of these gland. What are the three gland? Pituitary, adrenal and thyroid gland. So this is how blood glucose level regulated in our body. Thanks for watching.